Welcome back to the channel. I'm Chuggers. Today we're going to do a deep dive into Clenbuterol, check out the science behind it all, and see how good or bad this supplement really is. This is a controversial compound, but bodybuilders swear by it for burning fat. Is it a miracle fat burner or a ticking time bomb for your health? We're going to cover once again the pros, the cons, the side effects, the dosages, the hard science behind how this works. Plus, we're going to find out what doses could put you in a lot of serious trouble. Stick around because this is the wild one. Slap that like and subscribe button and let's get into it. Did you know Clenbuterol is not a steroid? It's a beta-2 androgenic agonist. This was originally developed to treat asthma by opening up their airways. Think of it as a super potent version of albuterol,
but with a dark side.
So it stimulates the beta-2 receptors in your body, which are a part of your sympathetic nervous system. This cranks up your metabolism, increasing fat breakdown, and also has some muscle sparing effects. A 2010 study showed that Clenbuterol triggers lipolysis. That's a breakdown of fat within fat cells, making it a go-to for bodybuilders in cutting cycles. But here's the catch. It's not approved for humans in certain countries and it's banned in sports, and that's why people don't risk it. But let's talk pros. Clenbuterol's big draw is the ability to torch fat while maintaining muscle. Here's what it does. 1. It's a fat loss powerhouse. Clenbuterol binds the beta-2 receptors, boosting cyclic AMP levels, which ramps up your metabolic rate. A 2016 journal of veterinary pharmacology found that it increased metabolism in horses, and bodybuilders report similar effects, losing 1 to 2% body fat in a few weeks when paired with a good diet. 2. Muscle preservation. Unlike straight up fat burners, Clenbuterol may help prevent muscle loss during a cut. A 2015 study in rats showed that it promotes protein synthesis, which helps you hold on to those gains while in a caloric deficit. 3. Performance boost. By opening up the airways, it improves oxygen flow and enhances stamina. A 2002 study of applied physiology found it improved muscle contractility in rats, meaning you can train harder and longer. 4. Potential metabolic benefits. A 2023 randomized trial in Metabolism showed Clenbuterol can improve insulin sensitivity in healthy men, hinting at an anti-diabetic potential, though that's all still experimental. Sounds like a dream, doesn't it? The risks are where things get a little bit more scary. Clenbuterol is not a magic pill. It is a high-risk compound with side effects that can hit hard. Let's break this down. Let's start with what I think is the worst, which is your cardiovascular health. Clenbuterol overstimulates your heart, causing tachycardia, which is a racing heart, combined with high blood pressure. A 2013 case series in Clinical Toxicology reports 2 bodybuilders with myocardial ischemia, meaning heart damage after Clenbuterol use. To make matters worse, a 2007 case in American Journal of Emergency Medicine described a guy hitting 180 beats per minute with atrial fibrillation from an overdose of clen. But long term, you're risking cardiac hypertrophy or even a heart attack. Anecdotally, I've had mates that have had heart attacks as well from too much clen use. Luckily, they survived. Second con, neurological effects. As a stimulant, it can make you jittery, anxious, or sleepless. It may even release dopamine, making it addictive. Users report feeling weird or like they've chugged 20 espressos. Third con, electrolyte imbalance. Clenbuterol can tank your potassium, magnesium, and phosphate levels, which messes with your heart and muscles. A 2016 case in Journal of Medical Toxicology noted hypoxolemia, which is pretty much the abnormally low levels of potassium causing a bunch of issues, after just 20 micrograms. Fourth con, muscle cramps and tremors. Expect shaky hands, cramps, headaches, especially early on. These issues hit over 80% of users based on anecdotal evidence. 5. Severe toxicity in the city. A 2020 case in Clinical Toxicology reported a 21-year-old suffering cardiac arrest from Clenbuterol misuse. Over 80% of overdoses need hospital care, with symptoms like chest pain, breathing issues, which because of the long half-life of Clenbuterol, which is 25 to 40 hours, issues could last up to 8 days. Sixth con, women-specific risks, menstrual irregularities, or fertility issues. Data is limited. If pregnant or breastfeeding, I'd stay away. Seventh con, It's banned in sports and it's illegal for human use in different countries around the world. Fun fact, it's also been linked to different food scandals over the years, poisoning multiple hundreds of people with tainted meat, mainly in Shanghai, 2006. Well, the science is clear. Clenbuterol's benefits come with a hefty price. So some science of how it works and why. So how does Clenbuterol actually provide these benefits? Well, once again, it's about those beta-2 androgenic agonist receptors. Those receptors are on fat cells, muscle cells, and in the lungs. And when Clenbuterol binds to them, it triggers a cascade effect, like fat burning, again caused by the enzymes which actually trigger triglycerides to break down into free fatty acids, which then in turn burns energy in your body. The muscle sparing, Clenbuterol reduces that protein breakdown, and it may boost synthesis by that beta-2 signaling. In 2015 muscle and nerve rat studies, it was seen that results of mass gain was evident within the rats. Human data is a lot weaker. You will not get results like anabolic steroids. Third was the metabolic booster. Clenbuterol raises your basal metabolic rate by 10 to 20%, which means you burn more calories at rest. And 4, bronchial dilators. This relaxes your airways, allowing for more oxygen intake, which is why it's a legit asthma drug. It actually works. So this also works so well because the half-life is quite long, which means you get more benefits over that longer period of time. But that same trait makes overdoses dangerous, as those effects will continue to linger as well. So dosages, is it safe or not? Clenbuterol dosing is tricky because there's no safe dose for non-medical use. But here's what you need to know. For medical use, like asthma, where it is legal, doses are 20 to 40 micrograms a day. Taken as tablet or syrup, kids' doses are lower and doctor supervised. Bodybuilding use. Users generally start at that same 20 to 40 micrograms per day, increasing by 10 to 20 micrograms every few days, maxing out at generally over 120 to 160 micrograms. Women use the same range, as that this is not a hormonal structured thing which affects men and women differently. Cycles generally last 2 to 6 weeks to avoid the tolerance effect, but some protocols are 2 weeks on, 2 weeks off, or 2 days on, 2 days off, keep the receptors responsive, also minimizing those side effects. Stacking effects, this is often paired in the bodybuilding world with some form of steroid like Winstrol for that extra fat loss, which again is going to up the risks. And here's the kicker, even at low doses, Clenbuterol can be toxic. People have had issues at 20 micrograms, not to mention 120 to 160 micrograms. And some cases have shown at 4.5 milligrams, which is 4,500 micrograms, severe toxicity, like lactic acidosis or rhabdomyolysis. Study in 2020 suggests that death is rare, but possible, as that case reported an unknown death of a high dose, which is why there is no safe dose for legal use. So what happens if I take Clenbuterol too far? Overdose is a real threat. It's not pretty. Studies show it can cause tachycardia, low potassium, heart strain, the high dose range, risking cardiac arrest, myocardial infarction, rhabdo, muscle breakdown, wreck your kidneys, lapsing, overdosing. Some symptoms include chest pain, nausea, tremors, shortness of breath, erythromyces. All right, so some alternatives and some final thoughts. Is Clenbuterol worth it? The science says no. Fat loss doesn't seem to be worth the heart risk. Safer options seem to exist. Legal supplements like Clenbutrol, which sounds like Clenbuterol, that's the whole point, mimics clen's fat burning without the toxicity. Diet and training, caloric deficit, high protein diet, intense workouts. That'll get you shredded without risking your health. Other fat loss agonists like your semaglutide, your tirzepatide, or your retatrutide. But Clenbuterol's banned for a reason. It's up to you if you want to roll your dice with your heart or your career. There you have it. Clenbuterol is a powerful fat burner, but the risks are no joke. Drop a comment with any of your crazy clen encounters. I want to hear some stories. Smash that like button, hit the bell, click subscribe. Remember, this is all just science. Next, we're tackling SARMs. Are they safe or sketchy? Stay safe, train hard, make good choices. I'm your boy Chuggers, there's no others. Peace.